very excited to get started. Welcome everyone to our webinar on VA healthcare benefits for military retirees, being hosted jointly by the Dayton VA Medical Center and Wright-Patterson Air Force Base. We are thrilled to have so many participants on today's session. I want to start by saying this event is being recorded, so if there is something you missed and later want to rewatch, you'll be able to do that. We will be sending you a link to that recording after this event. You can also share that link with anyone you feel may benefit from the information we're sharing tonight. My name is Ted Froats. I'm the Public Affairs Officer for the Dayton VA Medical Center. I'm also an Air Force veteran. And like many of you, once I had many questions about VA healthcare. So we're going to see if we can answer some of those questions this evening. Please realize that as a participant in this session, your microphone has been muted to minimize any distracting background noise. We do have a lot of participants on this webinar, which is why we're keeping everyone muted. But of course, we do want to hear from you. If you have a question or anything you want to share, you can tell it to us by clicking the chat button on the bottom right of your computer screen. Again, that's a little button on the bottom right that says chat. And you can type in your question and we will address it during this call as soon as we can. For the sake of time, if we don't get to your question, during this presentation, you can also reach us by phone or email, and we will provide all that contact information at the end of this presentation. Now, I'd like to introduce a few of the folks that we have with us tonight. I will begin with Mr. Mark Murdock, an Air Force veteran, also our Medical Center Director here at the Dayton VA. Mr. Murdock.
Thanks, Ted, and thanks to everyone for joining us tonight. We're very enthusiastic about the opportunity that we've had with Wright-Patterson Medical Center to really provide great care for dually eligible veterans. And we're glad that we have this opportunity tonight to share with you that benefit and what it can mean to you personally. We have had a great relationships with the folks from Wright-Patterson Medical Center over the years, and the leadership team. We have Colonel Lyons that you'll be hearing from tonight, and also Colonel Joyce Beatty, and they will tell you a little bit more about this from their perspective. But the partnership that we have had with these folks has just been tremendous. I also want to let you know that I personally received care from the team that we have at Wright-Patterson Medical Center, and we have a tremendous team out there taking care of our veterans, and they're fully embedded into the Red Clinic, and they're really part of they're part of our team, but they're also part of the Wright-Patterson team. And so I think as veterans, you know, it really is much of the same experience that you've had over the years. I have my care there for 25 years of my life. I have received services at Wright-Patterson Medical Center, and I can tell you that the care that I've received over that time has been tremendous. And now as a VA patient, being able to utilize those benefits as well has just been outstanding. And once again, we have a tremendous team that is here for you this evening to answer any questions that you may have. Maybe reduce if there's any anxiety that you have about thinking about this decision. It's a big decision, but I can tell you from the feedback that we're getting from veterans that have made this choice, that they are very, very happy with the way that their care is delivered and the way that they interact with the team there. So thank you once again for being on this call, and just very grateful to have this opportunity to let our team tell you more about it. Thanks, Ted.
All right. Thank you, Mr. Murdock. Next, we'll hear from Colonel Christian Lyons, Commander of the Wright-Patterson Medical Center, 88th Medical Group. Colonel. Maybe having just a technical difficulty. Scott, if you can try to unmute him on the attendee list. That's Colonel Lyons. All right, fair enough. We'll move on, but if Colonel Lyons, if you're able to come in later, that's all right. Just let us know. And I'll also check in with Colonel Joyce Beatty, the 88th Medical Group Hospital Administrator. Colonel Beatty, are you with us? And again, Scott, we might need you to unmute Colonel Beatty. Oh, Colonel Lyons, are you ready?
I am ready. Sorry, it says that my video is disabled, so I'm sorry folks won't be able to see me in my uniform in my office, but hopefully everybody can hear me out there now.
Yes.
very much for letting us to join this, and wanted to say thanks for allowing us to give you some information about really the exciting opportunity to be part of this PAC, which is the Patient-Aligned Care Team. So in order to better serve the population, the VA partnered with the Department of Defense by embedding a primary care team within Wright-Patterson Medical Center. So our PAC actually opened up in January of 2020, but we all know what has happened with the COVID pandemic, and I think this enabled some people to be able to make the transition to come into our PAC and be part of our team and part of the service here at Wright-Patterson Air Force Base. But it's a great opportunity because to be eligible for the embedded VA PAC, in addition to the VA eligibility, the veteran has to be enrolled in TRICARE Plus or Prime with the PCM at Wright-Patterson Medical Center, and the patient is encouraged to keep their TRICARE Prime coverage in order to keep access to family health and other. But enrolling in our embedded PAC unlocks the benefits the veteran has already earned, is entitled to. It's not a replacement of their TRICARE benefit. It's an additional benefit that expands healthcare options. And the primary benefit, really, of enrolling with this team is enhanced access and shorter appointment wait times that our patients will experience. So our current times are about 7 days out to get an appointment, but realize we offer many services that are same day, such as telephone consults and those of medical necessity. So as was mentioned before by Mr. Murdock, the PAC is co-located in our Red Clinic of Family Practice. So our folks, a lot of folks who are familiar with the base and Wright-Patterson Medical Center kind of know where to go to come in to see their providers, but you can use the same services when it comes to laboratory, radiology, and pharmacy, and you have access to all the specialty providers that we offer here at Wright-Patterson Medical Center. So we are excited about the opportunity to continue to grow enrollment. So we have 445 people already enrolled into the PAC clinic, and 79 new folks have been enrolled since the 1st of May. And we're hoping to grow that number because we think we have a lot to offer our veterans in the community. And with that, I'll turn it over to you, Ted. Thanks.
All right, thank you, sir. And finally, I would like to introduce Colonel Joyce Beatty, the 88th Medical Group Hospital Administrator. Colonel Beatty.
Good evening, and thank you very much for including us in this wonderful venue. I appreciate the opportunity to speak. I'm going to just echo what the boss said. We are really excited to have this patient-aligned care team, the PAC, within the Med Group. We have a great staff. We have a great partnership with our VA partners. I will tell you that we're going to have a couple of people talk to you about accessing the facility and using the clinic. And it's really no different than using our primary care clinics. Plus, you get additional benefits. And so we're excited to partner with you. We hope that you will think about enrolling into the PAC clinic. Currently, like the boss said, we only have about 475 individuals enrolled, so access is great. And you have providers that have been on staff for years and will not turn over like our military. So there's a lot of great benefits to it. And other than that, I'll go ahead and turn it back over to you, sir.
All right, thank you, ma'am.
Yes, sir.
Next, I will go ahead and start the main purpose of our call. I want to introduce Dr. Eve Connolly. Dr. Connolly is going to share how to best maximize your benefits as dual eligible veterans. Dr. Connolly. And Scott, if you'll also share the slides, please. Dr. Connolly, you are muted.
Hello. I'm Dr. Eve Connolly. Can you see and hear me?
Yes, we can.
Okay. So I'm the medical director for the Wright-Pat VA PAC team, and I am excited that you're here to talk to us today. I want to thank Mr. Ted Froats and Mr. Murdock and Colonel Lyons and Colonel Beatty for being here this evening and for all your support for our veterans and our new Wright-Pat VA PAC team. We really appreciate that. And I wanted to also tell everyone before I get started that we also have on the line Larry Sprinkle, who is a RN extraordinaire for the Wright-Pat VA PAC team, as well as our MSA Priscilla, who everyone talks to on the way of when you get impaneled. And we have NP Cole on the line, who is my provider. And then we have our entire primary care leadership team that's at the VA here as well on the line. So we have all kinds of expertise to answer your questions if you have any tonight. So I'm going to get started here. So we're the Wright-Patterson VA PAC team. We're established in 2020, and we have 453 veterans enrolled, and hoping to climb that with you guys tonight. So we're at the medical center. There's a kiosk in the Red Clinic. So when you come in to check in at our clinic, you would put your VA ID card there, or you can check in without it with just your name. Parking is closest at the MRI entrance, or at that clinic entrance. And this is a picture of where we are located. So we have signs that you can follow. We're in the back of this hallway. We take up this whole, all these offices down this line. Next slide. So like Colonel Lyons pointed out, we are enrolling dual eligible. So you have to be enrolled at the Family Health Clinic or Internal Medicine, have TRICARE Prime or TRICARE Plus, and then have that Veterans Benefit Administration letter with approval to receive care at VA facilities. We're enrolling those that are service connected above 10%, but I wouldn't get into that too much. Just if you think you could be eligible, call Priscilla, and we're going to be talking about Priscilla a lot tonight because she's the person that can take your call and then tell you and look up and see if you're eligible. So the next slide. So what are the advantages? It's a one-stop shop for PCP care. I've run into a lot of veterans who have a primary care at the base, a primary care at the VA, and with both primary cares writing orders and trying to solve problems that can get confusing, even dangerous with medications. So it solves that problem. Our staff has access to the DOT computers, the VA computers, so you have more choices to where you're going to do your specialty care, ancillary services. We can refer to the right PAT specialty providers if they're available, and if they're not available, we can refer to the VA specialists. So you save with a copay when your right PAT tries to send you out into the community. Then we can go over to the VA and kind of work the system and get the best price for your medical care and the best medical care. If you get your medications from the VA, you can get them sent to your house for free if you have a 50% greater service connection. We have great access to same-day care as well as routine appointments when needed. And like Colonel Lyons also said, you aren't losing anything, you are gaining VA benefits. We certainly aren't locking you into this. You know, we are attempting to provide superior care so that we don't lose you, but if you aren't satisfied with us, you could always go back to your DOD provider. That's not happening, so I think we're doing a good job. And the next slide. So this is wanted to go through our staff. We have two providers, myself and nurse practitioner Cole. So you will only see the two of us. You won't be shuffled around to different providers. I graduated medical school in 1996 and did an Air Force residency, and I'm an Air Force veteran of 7 years. Nurse practitioner Cole is family nurse practitioner certified as well, and she has experience in chronic disease management, primary care, and ENT. Next slide. Then we have two RNs, currently Amanda Ziles, who is an Air Force veteran, and Kelly Grigsby, they have a wealth of experience between them. I'll let you read that. And then the next slide. We have two LPNs, one 8-year Navy veteran, Teresa Brunner, and Amy Passmore, and she has 20 years of family medicine experience as well. And then we have Priscilla, who is our MSA, and she has served in the DOD primary care clinic, so she knows the DOD very well, as well as the VA for the past 4 years. So how to enroll? It's not hard. All you need to do is call Priscilla at this number. Make sure you have a pen and paper and write this down. If you don't have a pen and paper, remember extension 5816, and you can call the VA line, and the number is 5816, the extension. So you can enroll by bringing this the VA eligibility letter to the maroon desk at the Dayton VA, or you can call Priscilla and she can check. If you're eligible, she'll make an appointment for you to see one of us. And then once impaneled on paper, you'll still be impaneled to that DoD provider, but you will have us as your primary care provider. So before we get into questions, I wanted to thank you all again for being here, and I wanted to introduce you to one other very important person, Mr. Tim Drain, who is one of our first Right Pat VA PAC team patients. And after that, we will take all of your questions. And so with that, I introduced you to Mr. Tim Drain.
All right. I hope you can see and hear me okay.
We can hear you. I don't see you just yet.
How about now?
There you are. Now I see you.
Okay, my iPad's running a little slow. All right, you know what, they covered a lot of the stuff that I was gonna talk about. I'm also the office manager here at Family Health Clinic at Right Pat, so I got to see things from the start, from the infancy of this idea back in the fall of 2018 when we first started talking about it, and I got kind of excited because I'm one of those guys that fit the bill. I'm a Air Force retiree, TRICARE beneficiary, but I also have the VA benefit. And so now I'm dual enrolled and as well as dual eligible. And I couldn't be more happy with my choice. So I want to talk to you just a little bit about some of the advantages that I've experienced. And you heard them say that you're not giving anything up. You're not giving any of your benefits up by transferring your primary care over to the VA. It's the same, basically it's the same as when you were seeing your PCM at Wright-Patterson Medical Center. You go to the same clinic, you basically check in the same way. You're just seeing a different primary care manager. And if you've been around the military for a while, which most of you have, you know that being enrolled to military medicine, your PCM changes quite frequently, every 2 to 3 years, if not more frequently. So one of the things I was excited about is because, let's face it, as retirees, we're all getting a little older. And at this point in our life, continuity in your care and your provider is important. At least it was important to me. I saw that opportunity with this. So the continuity of the care is very important to me, and I'm sure it is to you. The convenience, like we said, we're located right there in the Wright-Patterson Medical Center. So it's right where you're used to going already. You go in, check in the same way, see your VA provider, but the minute you walk back out the doors, you've got all the TRICARE benefits that you've always enjoyed there right at the hospital, the pharmacy, radiology, the lab right across the hall. Everything's convenient. So you're not experiencing anything different from that standpoint. Where your big options come in, I think, is when you get referrals. Like Dr. Connolly said, you get a referral. It goes, because you're right there in the med center, the referral comes to the Right Pat Med Center. And if we can provide that service for you there, then it's no different than you were before. But the big options come when that service is not available at Wright-Patterson Medical Center, which I've experienced a couple of times myself. So that's when the biggest options for me come into play. I can go back to Dr. Connolly and say, hey, can you get me in over at the VA? Do they have this service over there? And if they do, I can choose to go that route. If they don't, then I have the choice of using my TRICARE benefit and going into the network, or I can see what else the VA can do for me in the network care based on my eligibility with them. So again, I can't stress more that you're not giving up anything, and all you're doing is taking advantage of a benefit that you earned. You earned the TRICARE benefit as a retiree, and you've earned the VA benefit as a veteran. And you know, I can't tell you how important that is, just to use all of the benefits that you have available to you. It just expands your options. The continuity of the care, again, is of utmost importance to me, and I'm sure it is to many patients that I get feedback from on that. And again, like they said, we haven't had, from the office manager standpoint, I work closely with Priscilla, the enrollment process and getting you identified in the Right Pat system as a member of or as enrolled to the VA Pact. And so I work closely with her and that team quite frequently, and we haven't had a patient that I know of that has said, you know what, let me go back to the way things were. Let me not use that benefit that I have. And so I'm real excited to be here tonight. I'm real excited to share that with you. And I'm even excited to have an opportunity to talk to you in person if you're in the clinic and you have questions from the DoD standpoint and you want to speak to me or talk about that. I'm more than happy to talk about it. Thank you.
All right, thank you, Tim, and thank you, Dr. Connolly, as well. So in addition to Tim, Dr. Connolly, Colonel Beatty, Colonel Lyons, Mr. Murdock, we also have a wide variety of subject matter experts here to help answer your questions. Any questions you might have about the Dayton VA primary care team there at the Wright-Patterson Medical Center. So let's go ahead and get to those questions. If you have a question, you can click on the chat window. That is at the bottom right. You'll see the word chat. You can click that and then type in your message. In fact, I think it'll actually prompt you. It'll say, enter chat message here. If you click there, you can type in your question. I'm not seeing any questions just yet, but I'm going to give folks a few minutes to go ahead and put those questions in there. In the meantime, I do see we have Larry Sprinkle with us. Larry, do you want to share your perspective on the Wright-Patterson PAC team?
My name's Larry Sprinkle. I'm was for 6 months the team RN with the Wright Pat Clinic, and what a fantastic opportunity. So just a couple things. Even though I've moved on with another opportunity in prime care, I really missed that team because they were doing fantastic things. Just a couple things that came to my mind that kind of tagged on to what everybody else was saying is it's a small team. So what's nice is you're going to be able to have a relationship with everybody on the team there, really small enough to let you know everybody. But with the power of combining the DoD and the VA, it's really big enough to allow you to have way more options than you would have going either way. I think Tim summed it up pretty well in the fact that the VA allows, I mean, they have services there. They have community care services. All kinds of different things there in the medical center. Sometimes those things are open, sometimes they're closed, and they're just doing active duty people at the time. So that could be a problem that the VA helps to eliminate. The other thing that I thought that I would hear people talk about all the time that they really appreciated was they could come into their appointments and have multiple issues. You know, if I had this and that and the other thing that I wanted to have addressed, sometimes it was hard with the DoD based on the time allotment that they had because of their volume. It was hard to get multiple things taken care of. You can get multiple things taken care of. And so everybody seemed to benefit from that. My experience out there was staff loved the veterans. Veterans were very, very open and friendly with staff. Give it a try. I think you'll find out that it's a wonderful environment. Larry Sprinkle, Team RN. Thanks, guys, for listening.
All right, thank you, Larry. And we do have our first question. Again, folks can type in their question by clicking that little chat window at the bottom right and typing in their question, but we've received our first one. The question is, appointment times, are we limited there? And I think maybe they're referring to what hours, what days appointment times might be available. And I don't know, maybe Dr. Connolly, would you be the best one to address that?
So we start seeing patients at 8:30 and we end at 3:30. That's the last appointment time. We are always willing to work with people, but that's what our available times are for right now.
Very good. And actually, she clarified her question. She meant the length of appointment. So is there a limit on how long an appointment can be?
So the appointments are no less than 30 minutes. And if we have something complicated, we can always extend that out to an hour-long appointment, and then for the first appointment, that when we see you, we always have an hour-long appointment, that get to know you appointment, make sure we've gone through all of your medical history.
Very good. And another question we've received, do you have to be enrolled at the VA first before you can go to the PAC team there at the Wright-Patterson?
Go ahead.
Sorry, this is Melissa from Eligibility and Enrollment. And we do need to be enrolled with VA Healthcare to be seen at the VA PAC team.
Very good, thank you. And we are at the very end of this, we'll share some slides that talk about how to get enrolled. In fact, we might dive into that now if there's not additional questions. But first, what is the advantage of prescriptions from the VA versus the pharmacy at the base?
The biggest advantage, I think, is that it gets mailed right to your house. It is mail, so if you're, we ask that you call in the refill 10 days prior so that the mail has time to get to your house when you need a refill. The other thing you can do is you can sign up for My Healthy Vet and you can get your refills through there and also message us through there, just like you do with TRICARE Online. So if you have to be 50% or greater service connection to get that for free, but the veterans who do try that are very happy. There is no longer waiting in line at Kitty Hawk or the main hospital pharmacy. Saves you a lot of time.
Very good. This veteran says, maybe I missed it because I signed in late. Does Wright-Patterson have the right to first refusal if they have the service, or can I choose to go to the VA, or if the referral is not available at the VA, can I go off base? I can repeat that question if we
I think I can answer that.
Yeah.
For you, just from experience, but also working in the clinic. Yes, when you're seen at the PACT out there at Wright-Patterson, that referral that you get will go into the same system at Wright-Pat. So it goes into the TRICARE system, and Wright-Patterson does have the first right of refusal for that when it goes into the TRICARE system. But there's always options, I believe, that you can talk to your provider about when you're in that appointment, and we can make sure that that referral gets to where you're going to get best served.
Very good. Thank you, Tim. And again, folks can ask their questions by clicking that little chat button at the bottom right and then typing their question in. What is the current average number of days to get a routine appointment?
I would say right now, 1.
That's great. So we've got a lot of access available.
That's true.
All right, thank you. What is My Healthy Vet?
So My Healthy Vet is similar to TRICARE Online, like the online system where you can message your provider, you can send them documents or pictures, you can request refills, you can, what else can you do on there? About anything you can do on TRICARE Online. You used to be able to do appointments. I'm not sure if that's still disabled. It was disabled during COVID. I'm not sure if that's back up and running or not.
Hey, Connolly, let me butt in just for a minute. Sorry about that. I know the My Healthy Vet people can look up their lab values. They can see test results. Pretty much anything people are used to getting onto their TRICARE Online and looking for is going to be available through My Healthy Vet. It's a fantastic, excuse me, secured way of allowing the veteran to reach out to the team and for the team to then respond to those veterans so that we're not playing phone tag, or we don't have to worry about any of the healthcare information that we want to share being compromised because it is a secure link. So.
Thank you. Another veteran asks, can we keep relationships with our off-base specialty providers for things we already see them for?
Yes, you can. You would have to, continue to use that TRICARE benefit, or if you have other insurance, you could do that. If we went through the VA always has first rights too for specialty care before they would send you out into the community. So I couldn't guarantee that you'd have that same community provider if you referred from the VA.
All right. But if they use their TRICARE benefit, they can continue to do that.
Yes.
All right. Thank you. Colonel Beatty asks, can we please clarify that you can enroll into the VA even if you're only just a TRICARE enrollee?
I think Diane Williams or Priscilla would be best to answer this question, if they're there.
actually, once again, this is Melissa from Eligibility and Enrollment. Being a TRICARE beneficiary does not necessarily automatically qualify you for VA healthcare. There is still process and certain eligibility criteria that have to be met. And the best way to find out if someone meets that criteria is to bring their DD-214 to either the Dayton VA, the Wright Pat PACT Center, or any of our community-based outpatient clinics, Lima, Middletown, Richmond, Springfield, and go through the process of just establishing that eligibility and registering for care.
Very good. And we'll share those slides in a moment to talk about how to do that. That's actually all the questions I see in here so far. So we'll go ahead and dive into those slides. Scott, if you can bring those up. That is about all the time we have for this evening session as we get the slides ready. We hope you found this event helpful and informative. If we didn't get to your question, don't worry. You can still call us 937, and you see these phone numbers up on your screen as well. 937-268-6511. That's the main Dayton VA Medical Center line. And then you see some extensions 2035 or 2159. Those are both, I believe, our outreach team. And the enrollment and eligibility office is extension 4105. We are available to help with any questions you might have. Also, extension 5336 is also eligibility and enrollment. Yep, there it is, 5336. National Health and Eligibility Center, you see that number there as well, 877-222-8387. If we can bring up the next slide. So we talked a lot about enrollment, and as we discussed, you do have to enroll with the VA Medical Center if you're not already enrolled to be able to receive care at that PAC team over at Wright-Patterson Air Force Base. In person, you can enroll at the Dayton VA at the Eligibility and Enrollment Desk or at any of our community-based outpatient clinics. You can do so online at www.va.gov. You can call the National Health and Eligibility Center at 877-222-8387. Or finally, you can mail in VA Form 1010EZ, and you can find that again on that website, www.va.gov. Next slide, please. And then finally, I wanted to give out that phone number for the VA PAC team over at Wright-Patterson, 937-268-6511, extension 5816. And I think that about concludes it for today's call. We do want to thank everyone so much for joining with us. We do want to encourage everybody to enroll with that VA PAC team at Wright-Patterson Air Force Base for all the reasons you heard tonight. It's really just so beneficial for the veterans who are already receiving care over at Wright-Patterson to be able to do that through the VA PAC team. It's just a great benefit. This will conclude today's call. We did record this, and we will be sending out that recording to everyone that was on the call today. Please feel free to share that with any veterans that you would like to see receive care here as well. But that will conclude today's call. Thank you all so much for joining us. Have a great night.